requiring transfusion. So anemia is a common complication of myelodysplastic syndrome. Myelodysplastic syndrome is one of the most common blood cancers in elderly patients. Around 90% of the patients are anemic, and 60 to 70% of the patients will end to be transfusion dependent. Treatment of anemia, especially in what we call lower risk MDS, remains an unmet need and challenging, and there are currently limited options available or approved for the treatment. Sotatercept is a novel and first-in-class activin type 2A receptor fusion protein. It acts on late-stage erythropoiesis to increase mature erythrocyte release into circulation via a mechanism distinct from erythropoietin. It stimulates erythropoiesis and increases hemoglobin level in healthy volunteers, supporting its clinical development for treatment of anemia in patients with lower risk MDS. So the objective of this study is to determine a safe, tolerable, and effective dose of sotatercept in patients with anemia and lower risk MDS or non-proliferative CMML who are refractory to erythroid-stimulating agents. So the key eligibility criteria on this study was the International Prognostic Scoring System, which is the standard system used for staging patients in MDS, defined as low or intermediate 1 risk MDS, or a non-proliferative CMML with white blood cell count less than 13,000. Patients had to have anemia requiring at least 2 units of blood transfusion in the past 12 weeks prior to enrollment for hemoglobin level of less than 9. They had to have no response to or loss response or low chance of response to erythroid-stimulating agents, restricted by measurement of the serum erythropoietin more than 500. Majority of the patients on the study had prior ASA exposure, and majority of them were heavily treated with several agents before, including other clinical investigation agents, and they had high transfusion burden. So patients received subcutaneous sotatercept at different dose levels or the cohorts, 0.1, 0.3, 0.5, or 1, and the treatment was administered subcutaneously once every 3 weeks. The efficacy was evaluated in the overall population as well as in 2 defined populations, what we defined as a high transfusion burden and a low transfusion burden. The high transfusion burden patients were those that had red blood cell transfusion more than 4 units within 8 weeks, and the low transfusion were the ones that received blood transfusion less than 4 units every 8 weeks. So overall, hematological improvement measured by a standard criteria International Working Group 206 criteria was achieved in 24 out of 53 evaluable patients, 45%. 5 of the 45 high transfusion burden, 11% patients, achieved red blood cell transfusion independence. And 5 out of the 8 low transfusion burden patients, 63%, achieved both red blood cell transfusion independence as well as a mean hemoglobin increase more than 1.5 gram per deciliter sustained for more than 8 weeks. Sotatercept was generally well tolerated. 20 out of 54 MDS patients, or 37%, experienced more than 1 treatment-related adverse event. Most of the adverse events were not necessarily related to the treatment, and they were grade 1 and grade 2 toxicities. So this is efficacy in high transfusion burden patients. As I mentioned, there were like 45 patients on the study that were classified as high transfusion burden that were evaluable. 19 or 42% of them had a transfusion reduction, or reduction in the transfusion burden, and 5 of them, 11%, became completely transfusion independent. This is a representation of the patients that became transfusion independent. As you can see, here is the transfusion record before, and this is the hemoglobin prior to study, and when patient enrolled on the study, there were no subsequent transfusions seen, and the hemoglobin level was maintained at higher level, and those are the every 3 weeks treatment received subcutaneously. In patients with what we labeled as low transfusion burden, 5 of the 8 patients, 63%, achieved red blood cell transfusion independence, with an increase in the hemoglobin sustained more than 8 weeks. 67% of the patients that received the 1 milligram per kilogram dose achieved that response. So in conclusion, or in summary, sotatercept showed promising evidence of clinical activity in this cohort of lower risk MDS patients who were anemic and refractory to ASA with a challenging and unmet need for treatment. Sotatercept was well tolerated in lower risk MDS patients at the dose levels tested. Further exploration of higher sotatercept dose levels and long-term treatment is planned and ongoing. Thank you very much for listening.